So good afternoon. We have a small session today, very short session, not very long, live session on the care in the first 3 days after a hair transplant. I feel that the first 3 days care is the most crucial. These are the days when the patient is yet to get used to caring for his transplanted hair. After the third day, it becomes a cakewalk. The cleaning process in the morning and the cleaning process in the evening becomes like part of your life. It's very simple. But in the first 3 days, it takes time for you. You probably think that you're probably not doing it wrong. You consult with the clinic. There are certain things which you have forgotten and certain things you are unsure of. So you get in touch with the clinic in the first 3 days. And these are the first 3 days when complications like swelling of the face can happen. Some grafts can be lost if you hit your head somewhere. If you in sleep on the first night dislodge some grafts, this is the time when most of the side effects of the hair transplant happen. And this is the time when the posture also has to be little strict and stringent. After this, the posture is not very cumbersome, and 3 days, so the first 3 days is the most important. And the most important day is the first night after the hair transplant, when you have to lie in an upright position, leaning back at 60 degrees. No, if your temple points have been done, no chewing. Be very careful when you're talking to anybody. You can be on WhatsApp as long as you do not bend down, because if you bend down due to gravity, the swelling, the edema after surgery can come into your eyes, and you'll wear sort of a look which is unappealing. And if you're traveling by air, it can cause you a little uncomfortable feeling when people stare at your face. And the security will check you twice before letting you in. So those are the problems. First 3 days, if you take care, there's nothing that goes wrong. And even the first 3 days, if you're careful, nothing much can go wrong if a clinic explains to the patient properly the post-operative care. So now we are dealing with the first day after the procedure. The first day after the procedure, you come to the clinic at around 10 o'clock at a designated time, whatever is convenient to you, but usually it's 10 o'clock, because by 10 o'clock my harvesting time is over and I'm free for about a fraction of about, say, 45 minutes. And that's the time when I would like to see the previous day's patients, because if you come early, I'll not be available because I'm doing the harvesting. If you come later than this, then the OPD starts, and that is the time I'm very busy. I cannot devote much time to you. So try and come at the designated time, which we know one day before, whether 9:30 or 10 or 10:30, depending on the type of case that we have listed the next day. We do only one case, so we're pretty sure what time we have free for you. So this talk is basically for patients who have undergone a procedure with me. Every clinic has different protocols of care after a hair transplant. Every clinic is not the same. Every doctor has, because of his training or the specialty he is in, different thought processes and different concepts of wound healing and recovery. Me being a plastic surgeon, we are more careful about the asepsis, more careful about wound healing than most other specialties, because that is the backbone of our specialty is wound healing, proper wound healing. So we are very particular about wound healing after hair transplant. So when you come the next day morning, you come around, say, 10 o'clock, the nurses will take you to the cleaning area, to the dressing area, and take off your bandage quite gently. It is not painful at all. Some amount of anesthesia is still there. It is not painful at all. And once the dressing has been taken off, the dressing is only in the donor area, not in the planted area, by the way. The planted area is covered only by the bandana on the first night and for 3 more days or 5 days. You are not wearing a hat. So the bandage at the back of the head usually comes off the next morning. The beard also comes off the same morning. Many times people do not have any bandage of the beard on the day of the procedure itself because it heals very fast. It's got loose skin and very small punch holes, 0.65 millimeters in diameter. They close very fast. So beard is not much of a problem as far as healing is concerned. Those circular wounds due to the punch, they contract very fast because the surrounding skin is very loose. So contraction is easier, unlike in the scalp donor where the scalp is tight. It's a tight skin, so it takes time to for the circular wound to contract. So the beard heals very fast. So all the bandages are usually off on the day, one day after the procedure, and then we clean up the whole area and teach you how to take care for the next 2 weeks. For the next 2 weeks, starting the day after the procedure, you are supposed to clean your planted area and your donor area meticulously as told to you, as explained to you on this day. That is the day after the procedure when you come to the clinic at 10 o'clock. So basically it is a pink shampoo, we call it as a pink shampoo, and we'll give you a booklet that we have prepared about how to take care of on the night of the procedure, what medicines to take on the night of the procedure in the next 5 days, and what are the instructions for doing the shampooing process morning and evening. We call it the shampooing, but it's not actually shampooing, it is application of medicated solution. But for ease of understanding, we say that it is a shampooing process. So it's not shampooing, you're not going under the shower. You can't go into the shower for 2 weeks actually. So this is the booklet will be given to you. If you are computer savvy, if you are more digital in your orientation, we'll send you an e-copy. So this contains everything, all the care for the next 2 weeks, and for the next 6 months. It will also tell you in the timeline of growth what to expect and what not to expect in the next 6 months. So what to expect and what not to expect. And commonly asked FAQs, frequently asked questions, are also covered in this booklet. So it's a rather not very exhaustive booklet. It has just about 32 pages. It gives you a broad overview of points which you might have missed in the instructions given on the day after the procedure. So that is it. So what is the care after the procedure? What is the shampooing process? So basically we clean the whole planted area with saline. I'm telling you this because this is my protocol. Your doctor, if you've got your hair transplant done somewhere else, or getting your hair transplant done by some other technique, the care might be very, very different. So in my technique, we do the shampooing process morning, evening. It is very simple. You wet your hair from behind forwards with a saline bottle. A hole has been made into the nozzle, and with a strong jet of water, you wet the entire planted area from behind forwards. It should not be against the direction of the hair. The hair is pointing forwards. So if you direct the stream from front backwards, what may happen is some grafts, because the grafts are still loose. They're not as loose on the day of the procedure, but they still loose. The jet of water has very great force. It might just yank off some grafts. So it's always better to follow the direction of the hair and hold it between both your hands and wet your planted area from behind forwards. Once that is done, take the gauze that we provided, the cotton gauze, the cotton cloth, small cotton cloth we provided, fold it in 4 corners, wet it, because if you do not wet it, the pink shampoo will not stick, it just fall off because of the forces, the surface forces. So wet it, and then 2 or 3 drops only of the pink shampoo. It's a medicated solution, and then dab it dab it over the planted area from behind forwards, over the entire planted area from behind forwards, because it has to be in the direction of the planted hair, not against it, and also the temple points, front backwards here, and the crown you can do it according to the whole pattern, because that's how the grafts have been planted. Once this is done, throw it away. Then take again the saline bottle and with both the hands squeeze it and wash off the shampoo which has been dabbed onto your grafts. Nicely, thoroughly clean it from behind forwards. Once this is done, take a dry gauze, fold the four corners so that the contact surface is not touched by your hands. Your hands should be clean. And dab it from behind forwards so that the excess fluid is removed from the planted area. After this is done, sit under a fan for about 2 minutes, let it dry out some more, and then using your antiseptic solution, the blue solution given in a spray bottle, you spray, close your eyes and spray from 2 feet away, right and from the left. So that is the antiseptic, and then you can wear your bandana, and if you're going out, you can wear your bandana. If you're at home, no need to wear a bandana. Bandana will be with you for about 5 days, after which you can wear a loose fitting baseball cap with a horizontal visor. It should not be pressing on your temple points if your temples are done. It's a trucker's cap. If you want, we will send you a photograph of the type of cap that I'm hinting at of your size. So it should not press on any of the planted areas, neither the frontal area or the crown area, and definitely not the temple points. So this is it. This care continues for 3 weeks, and in between, on the 5th day, we introduce the Gillette shaving foam. The purpose of the Gillette shaving foam is it contains hydrogen peroxide. So it clears out all the crusts, all the dirt, the dead tissue very well. You have to take it between your 2 fingers and apply it from behind forwards over the planted area. Wait for about 2 minutes for it to act, because it takes time for it to act, and then wash it off from behind forwards using the same saline solution. Now this saline solution can be changed, can be replaced by mineral water or bottled water. Do not open the cap, just make a hole with the needle, sterile needle we provided you, and squeeze the bottle and clean the area nicely and properly. So on the 5th day, I've told you that Gillette shaving foam will be used so that your crusts come out faster. And usually the crusts come out by 2 weeks mark. I have seen that in Caucasians, the crusts come off very fast, probably that their dermis is little less thick than Indians. So usually 10th day, Caucasians or whites, their crusts come off, but Indians, it takes about 14 days, if not more. 2 more days it may take. But till such time the crusts are not yet off, they're still on. You are recommended to continue this cleaning process morning and evening, and do not go under the shower. You can take a body bath. You can take with a telephone shower or a bucket bath with a mug and bucket, and you can clean your face with a wet towel with soap. But no tap water, no shower water should fall on the planted areas till such time the crusts are off, because you can still get infected. So after the crusts are off, you go under the shower. Even if 1 or 2 crusts are on but they are lifted off, you can go under the shower, take baby shampoo, create a thick lather on your head, and go under a very fast shower, and all the crusts which are left now will come off. Most of the crusts which are not yet come off are all lifted up with the hair, so they will come off very easily. But mind you, some hair will also come off, because this is the time after 7 days and the shedding will start. And do not worry, it is only the hair which is coming out. The receptacle, that is the bulb, the root, is still inside. That is a living tissue, not the hair, and that will grow a new hair in the months to come. So nothing to worry, shedding is a natural process. Be prepared to lose about 65%, if not more, of your planted hair by the time you are on the 4 weeks mark. So after this, the hair growth medication will start. Hair growth medication, finasteride, can start immediately after your medications are over on the 5th day. But as far as minoxidil is concerned, we have to be a little careful. Why? Because the skin is a little tender. It's just been operated. It is a little pink. It is still healing. And you have to be very careful that you do not put any irritant, because minoxidil is an irritant. You should not put any irritant on the planted area. So you start with 2% minoxidil, only once at night. Put 2% minoxidil at night over the planted area before you go to sleep. Before you go to sleep, and in the morning you wash it off. Continue this 2% minoxidil for 2 weeks. If there is no redness, there is no reaction to minoxidil, Then after 2 weeks mark, you can switch over to 5% minoxidil, which you continue for 5 months. After which, we review the medication, 5% minoxidil, and finasteride is reviewed at 6 months mark. So, finasteride I've talked to you, biotin, yes, it goes with not very, very important, but biotin as well. And the care of the donor area. Now, the donor area, dressing is removed the day after the procedure, as we discussed. And antiseptic ointment, that is neomycin, neosporin is applied morning, evening in this area. But be careful in the first 3 days, don't wipe off. Just apply it over the previous day's layer, nothing will go wrong. It is only when you start, only after 3 days that you can remove the previous layer and apply a fresh one after cleaning it with saline. After the 5th day is over, when you use Gillette shaving foam for the planted area, the recipient area, also remember to use this Gillette foam at the back of the head, because by now there's some dirt there which is accumulated and we want it off. And nothing better than Gillette shaving foam, which contains hydrogen peroxide to clean up the scalp very well. It is after the 5th day that you do not any longer feel messy, because everything is cleaned by Gillette shaving foam. Okay? Now this ointment that you apply, neosporin, is to be stopped after 3 days of the procedure. And then we apply aloe vera lotion for 2 weeks. And this is the care of the donor area. And donor area, you should also be very careful that you sleep on a soft pillow. You do not wear a tight cap, and do not get a head massage after the procedure for about 6 weeks. And do not rub the aloe vera lotion very harshly, because there could be pain. You might feel pain. Many times patients start complaining of pain in the donor area. Now this is nerve pain. We are using a punch which is of the depth of 3 millimeters usually, and width or the diameter of about 0.8 to 0.9 millimeters. This is enough to cut the superficial nerve endings which are just on the surface. And these nerve endings, when they are healing around 7th day, 10th day, they cause nerve pain in some cases, not in every case. But if this is severe, like in some patients it is severe, then there is certain medication which is written on the reverse page of the sheet which will be handed over to you after your hair transplant. And you have to take these medications, tablet Combiflam, tablet Alprazolam, and if with this it does not get better, then tablet Pregabalin, 75 milligrams twice a day. Do not do heavy exercises in the first 1 week, just do light exercises. Heavy exercises only after 2 weeks, sports after 6 weeks, and swimming after 3 weeks of the procedure. So this is the care after the hair transplant. For further details, there is much more. This is just what comes to my mind, I'm telling you. But this is a definite protocol that all clinics have about care after hair transplant. Every clinic is different, because every doctor's experience over his career, surgical career, is different about wound healing. And that shows itself in how he devises his aftercare protocol following a hair transplant. But if you have any question still, provided you're not being managed by another doctor in the first 6 months after hair transplant, please leave a comment in the comment section below, or you can send me a message on the WhatsApp numbers provided in the link in the description box below, or my email address available on the website. So thank you for watching. That was the talk about care after hair transplant, the first 3 days. Have a nice day, and look forward to seeing you in my next session. Have a nice day.